Today, we are excited here at the Southwest Center for Pediatric Environmental Health to welcome Kate Friedman as our speaker. She will be teaching us about incorporating surveillance system data and other online tools to support environmental health analyses. Just some acknowledgements. This presentation was supported by the American Academy of Pediatrics and funded in part by a cooperative agreement with the CDC and the Agency for Toxic Substances and Disease Registry. The US EPA supports the PACEUs by providing partial funding to CDC/ATSDR through an interagency agreement, and the findings and conclusions in this presentation have not been formally disseminated by them or by the EPA and should not be construed to represent any agency determination or policy. Use of trade names that may be mentioned is for identification only and does not imply endorsement by any of these government agencies. Here's our required disclosure to participants prior to the activity. If you are a nurse and you would like to receive continuing nursing education credit, just remember you need to register and sign in and then complete the evaluation as well. If you are part of Texas Tech Health Sciences Center El Paso, then we have the online check-in information here. You can use the QR code, or if you go to the link, then it's activity code 3754. And I'll put that in the chat as well. The next grand round, since we host this the third Thursday of every month, is going to be August 15th, 2024, from 11 to noon Mountain Time, and the topic will be invasive weeds, a look at the epidemic of pediatric THC edible poisonings. And this will be from Dr. Ari Phillip from the UAMS College of Pharmacy. You can register using this QR code here. And if you're on the mailing list, we'll send you the info as well. Okay, let's see here. So we're excited to have Kate Friedman, who's going to present to us on incorporating surveillance system data and other online tools to support environmental health analysis. She is an environmental health scientist supervisor and environmental epidemiology and toxicology scientist over in Louisiana. And Kate, we are very excited to have you here today. Let me go ahead and make you the presenter.
Okay, hi everybody. Can you all see my slides?
We can see them perfectly. And attendees, if you have any questions, please put them in the chat and we will have Kate answer them. There should be plenty of time at the end. And I'll be moderating the chat. So if you have any questions about documentation or anything we can help you with, just throw it right in the chat.
Okay, just make sure.
Kate, take it away.
Okay, I'm not able to see the chat. Let's see. Okay, I see it now.
Don't worry about that. I'll be monitoring the chat, so we'll make sure we get everyone's questions for you at the end.
Okay, so I'm going to stop video and I'm just going to start the presentation. Okay, so today I'll be discussing incorporating surveillance system data and other online tools to support environmental health analyses. My name is Kate Friedman. I work with the Louisiana Department of Health. My section is environmental epidemiology and toxicology, and our program is called Environmental Public Health Tracking. So some of the main takeaways and learning objectives of today's presentation include that emerging research continues to link environmental hazards to disease. A library of evidence can be referenced to support data exploration, and you're going to hear this term a lot as we go through this sort of surveillance systems, explore data. The potential environmental connections to health outcomes are at times just an afterthought, maybe understood to be like a smaller wedge of a pie chart, but this is maybe only actually due to the fact that we don't have a lot of current knowledge in this that sort of wedge for environment. This also includes nutrition and genetics. So this perception may actually be due to the complexity of studying the question rather than the actual distribution of how much, each is contributing to disease. So exploring data with modern online tools includes access to various environmental public health surveillance systems, which I'll be discussing today, including the CDC tracking and grantee networks to support preliminary environmental health analyses. And one point I wanted to make about that is we don't want to fall into the trap of if we don't look, we won't find it. So these surveillance systems are a way of kind of looking at a first step to data exploration. Additional learning objectives would be, online data exploration can provide a first pass look. These are other things that you'll hear me say is preliminary, it's, possible, first pass, and environmental health issues. This is to spot possible trends. So it's a first pass look so that we continue on in our investigation and our studies if you feel like you've spotted something. And this will promote us to look deeper, and this will promote, this will look more into the kind of questions related to geography and populations. Where environmental associations are believed to be secondary or only minor contributors, it's still valuable to have an understanding of these risks to communities because awareness can guide health intervention. So kind of referring to this pseudo pie chart at the bottom, I feel like sometimes we see lifestyle factors as being the majority contribution to some of the things we'll be talking about today, but and maybe we know more about underlying health and even genetics, but we know less about the nutrition and the environmental factors. And it may be more of a challenge to discuss environment and nutrition as well and genetics. So there are many different types of studies that we could, follow through on, but the ones that we mostly use are, we call them ecological studies. There's a really good resource I put in here, and Dr. Walker linked to all of these links in the chat, so you can follow along as I go through the presentation today. But I found this is a really good resource from the British Medical Journal. They call it epidemiology for the uninitiated. You can get past that word, but it's actually really good. They talk about all the different types of studies. So mostly what we do is, and also want to differentiate between the words etiology, or spelled etiology by the British, but first is epidemiology. I think in the medical field, you might use etiology a little bit more. But this is the way they phrase it. Most epidemiological investigations of etiology are observational. They look for associations between occurrence of disease and exposure to known or suspected causes. So in an ecological study, the unit of observation is the population of the community. And so the disease rates and exposures are measured, in a series of populations, and the relation is examined. So these are, the information that we have is really abstracted from statistics, and it doesn't require the sort of a lot of that, time. It's just data, exploration, and it's a preliminary first step. So populations can be compared in this way and defined in various ways. So just briefly, if you're unfamiliar with our program, Environmental Public Health Tracking, we're funded through a cooperative agreement between Louisiana Office of Public Health and the CDC in Atlanta. Their definition of the program is that at the local, state, and national levels, the tracking program uses a network of people and information systems to deliver a core set of health exposure and hazards data, information summaries, and tools to enable analysis, visualization, and reporting of insights drawn from the data. I actually really like that definition. I think that kind of encapsulates what we do. And a little bit of history shown on the right here. You see this graphic. This came from one of the reports that we published. This relates to mercury in fish tissue. And this goes all the way back to 2009 when we actually participated. This is before we even joined the program, in some demonstration project activities sponsored by the Association of State and Territorial Health Officials, or ASTA, and a mentorship with the state of Missouri. And this was before being funded, and we were able to look at legacy, I guess, fish tissue data from 1994 to 2010. And this graphic is showing, all the fish species. The majority, of course, are okay, but some of these were, of course, for sensitive populations, we'd have to restrict how much fish they would eat of certain types, and of course, the general public. So just give you a better definition for them. Yeah, sensitive populations, children and women of childbearing age or nursing. Another thing we did actually was related to looking at, let's see, several cancers within Louisiana parishes along the Mississippi River Industrial Corridor. So that was another demonstration project that was enabled with funding, and then we eventually won the grant. And that looked at water quality data near wood preservation and treatment sites or creosote sites. So one thing I wanted to point out on this was just of the four you see at the note at the bottom, there were four species: largemouth bass, bowfin, freshwater drum, and black crappie from the report that had the highest mean fish tissue mercury levels among those inland species that were sampled. So we're going to take a look at that in our surveillance system. And also this just shows a graphic of, all of the states that are currently funded that are grantees in the program, and also one city, Marion, Indiana. So we're growing. The national programs expanded to 33 states and one city as of 2022. Every fall and spring, we provide data to the CDC. We call these data calls so that they can begin to get a look nationally at what's going on with the environmental data and health data. Most of our programs host a program website and data explorer. So tracking network is one integral piece of a process that continues to evolve and become available to the states. But as you might notice, US rates are going to be unavailable for some of these measures due to the gap in the national coverage. But it still allows comparisons across participating states and to start to develop baseline data within our states. So how can a public health practitioner, doctors, medical professionals apply these surveillance tools and data? We do create these nationally consistent data and measures. We call NCDMs, which allow for standardization. These data can support surveillance projects, partnerships, and data analyses. And so physicians, nurses, public health practitioners can even download these data for use in other applications and visualizations of the data, which I'll show some of those today. Just wanted to highlight this Adventures in Teamwork. This was the tracking program's promotions, which we do annually. That happened last week. I think that's a cute graphic. They had badges that you could get every time you kind of looked at one of the cool things that we're doing right now. And so this one really applies to what I'm going to be showing you, because we, throughout this presentation, I've incorporated the work and tools of several other agencies. It's not just our tracking program, health officials, scientists, and academia. So I'll describe our surveillance tools, but we couldn't do it without our partners. So let's begin. Again, Dr. Walker provided the link in the chat so you can kind of follow along as I go through each of these surveillance systems. First one I'm going to show you is from our website and our data explorer. This will be one of the few where I actually, I've got a lot of these already open, but I just we'll start from the actual, Google and searching so that you can kind of get a feel for how you get to our website. Before we do that, let me just kind of give you a little more information. We are going to be adding a mercury advisory map reference. Yes, as we do this. But yeah, so here's the first thing I wanted to show you, and this is where you can get, this is another source of fish tissue mercury data. Can y'all see my screen? Got a lot of these links already pulled up so we can save some time.
We see the current mercury advisories.
Good. You can see the map with the red.
Yes.
Okay. So that's one of the first links you saw on the slide. It's also in your Word document, and you can, this shows for Louisiana anyway, you can get more information in the PDF form of health and fish consumption advisory. Okay. Excuse me as I kind of navigate between a couple of things. So this gentleman caught, I guess, the third largest freshwater drum last year. He is located, and I'm not pronouncing it probably correctly, but Bayou Chevrel and Lake de Almas, maybe. It was, as you saw in the graphic previously, that it was among the four fish species with the highest mean fish tissue mercury levels. among these sample data, and we do have newer data that's coming. It's been a little sporadic. We'll be adding to our data explorer as well. Another link, the Department of Environmental Quality also has some fish advisories. Let me just show you where those are. That link is included in your Word document as well, the field notes. And it's going to look like this. You can go to the DEQ's website and get a lot more information on these fish advisories. Similar to what we showed, not exactly the same. You just hover over and it's going to give you links as well. Okay, so let's go and do a Google search. Just going to put in Louisiana trout. That is going to pull up our tracking program website, our Data Explorer. Hopefully you can see this. Our website is the different types of information that we have, a video, what we track, and so on. But to get to the actual Data Explorer, you can choose the icon, which I showed on the slide, or you can also go here. So I'm just going to do that. Accept the disclaimer. And we want to look for that freshwater drum, right? So I'm just going to put in the keyword there. Let me do it. Okay, my search isn't working. Hold on, maybe I have too many things open. Well, I know where to find it, so let's go get it. It should pop up there and give you that directly what you need, but we're going to go look for that freshwater drum. And this, again, is legacy data, which is being updated, but let's go take a look at that now. It gives a lot of information on, fish are healthy. But there are some species and amounts that we should be regulating, or just be watching as, we're fishing to make sure we're not eating too much. It's, all those links are here as well. And this is what our Data Explorer will provide to you. I know from looking this up previously, we can look up where this gentleman caught that fish and we can zoom into where he is. So he's down here in this bayou and this lake. And so you can hover over these points and kind of see what the average mercury concentration was. Here are your screening values for sensitive populations in the general public. So you can get an idea this way of, what's going on where he is. And so maybe that fish, not too bad. So I think it's a good resource if you're a fisherman and you want to kind of look and see what's going on in your area and get to those advisories quickly so that you can, be more protected. Okay, that's the first one. Now let's see. Keep going. Bear with me as I try to get all these. Too much open on this screen. Yeah, DEQ is our partner on this, getting these fish through our section. Okay, so we're now going to move into our scenario, codename Safari. You're a doctor. You gently promoted smoking cessation where necessary, treated symptoms for asthma or COPD, and recommended cancer screenings based on the latest available guidelines. You're concerned, however, that some of your patients have indicated they live in areas of poor air quality. You are tasked to find ways to provide information to patients about their health risks from poor air quality and to summarize environmental risks from lung and potentially other cancer risks in the community. So I'm going to serve as your guide and point out some information, tools, and resources that I would use, specifically surveillance system, to try to answer this task. But each person would have maybe their own path, resources that they know about. So I'd love to hear about ones as we go along that you might have found really useful. Please add them in the chat, form each other. Answering this question and this task may be a bit overwhelming if we're not prepared, but there are actually information and data out there. I know this is a hard one. So as an environmental scientist, I can show you the process I would take, but not being a physician or nurse in the health field, maybe this demo could just provide some insights that maybe you could also use. So one of the first things that I found really valuable is under the American Lung Association for this question. They have I've minimized my screen. I can't get my Google back. 1 second. It's hard to grab. Okay. Can y'all see? Hopefully I can.
Yes, we see your window with the lung.org.
Perfect. Okay. American Lung Association. If you go here to clean air, they've got some really good resources that I found. How to know if your air is unhealthy, keeping pollution out of your home. They have new information on radon, dust mites, you name it, schools, clean air at work. So to me, and I've provided this link to you, this would be a great place to start. Talks about the air quality index, 10 tips to protect yourself from unhealthy air. So these are all, I think, places that you could point a patient, maybe if they're really concerned about this in their community, or if you're concerned. I think that's a really great starting point. Also, of course, the US EPA, they have several sites where you can read more about pollution and patient health, specifically tailored to medical professionals. And what is EPA doing specifically to reduce exposure to carcinogens and prevent cancer? I'll show you a couple of those just quickly. And of course, it's hard to keep an ear out for local concerns. I mean, who among us can really be on top of things that are happening, in that sphere? But it's still, of course, something we should each try to do. I recognize that it's a challenge. So let me see. Here's one of the ones for EPA. Patient exposure in the AQI. Should I recommend that my patients reduce their exposure to particle pollution? So, what's the AQI? I think these are really great resources. Are y'all hearing that, or is that only me? Are you getting any feedback?
Your sound is still good.
Okay, good. All right, so those are the EPA resources. So that would just kind of be materials that we can start getting ready. Of course, you can ask the PSHU. Picked up some really great materials when we had the symposium in New Orleans. Everything from these little book holders that talk about dusty asthma triggers, know your asthma triggers, to mosquitoes, to you name it. So it's a lot of materials like you can hold in your hand, or you can print out, that you could give to your patients as well. And I'm sure they'd be happy to share these with you, or point you to the places where they could give you some more of these materials. So that's where I would start. So it's not impossible to kind of give this information to your patients. I know it is a challenge though, because it's a hard question. A few points. The public perception may be that the risks from outdoor air are greater than from indoor air. Since we don't immediately know individual exposures, I would argue that we discuss both topics. Of course, cancer latency, right? It varies by cancer type, but it doesn't prevent our ability to look into the available data so that we can inform ourselves. I'll show you some of that next. And again, in the case of the state health agencies, our purview statewide. So it's difficult when faced with the public expectation sometimes of having local knowledge. I'm sure that's probably similar for medical professionals as well. Not excluding, the time variable. It's very difficult to have the time to do these types of things. So here again, I just want to mention they are including radon now, which I'll talk about briefly. These are those EPA focus areas. What are they doing to prevent cancer? And I like this. They're trying to close the screening gap, address environmental exposures, decrease the impact of preventable cancers, this type of things. So nutrition, I've heard it discussed. I think it's a difficult discussion, but I think framing it differently could also be beneficial to patients. Because there are cancer fighting foods, right? Instead of the sort of trigger words, I think obesity, BMI, diabetes, hypertension. I think people maybe tune these out a little bit when, they're spoken to, even though it's 100%, valuable to, of course, that's the reality. But there's another way, maybe another approach to kind of talk about, incorporating more vegetables, more fruits, more nuts into your diet. And that's because they're cancer fighting. So this was a great resource I found from D. Anderson. That's right there by y'all in Texas or Houston, right? And they have, just this is another thing that could be shared with patients. 36 cancer fighting foods, things that will help lower your cancer risk. So I included that link. You might have this already, but I like that one. Heavy metals. Okay, let's just talk about that for a second. Definition of a heavy metal, a relatively high density or high relative atomic weight group of metals and metalloids that have relatively high density and toxic, even at very small parts per billion levels. So some of these things are actually essential. And some, of course, the dose makes the poison. So they can become highly toxic. Our heavy metals list: cadmium, arsenic, lead, and mercury. There is no known human benefit for those heavy metals, but believe it or not, things like chromium, nickel, copper, cobalt, aluminum, manganese. I know these things are actually in our vitamins, iron, you name it. So it's interesting to me that in trace amounts we actually need these micronutrients, and our bodies have a sort of receptor or dock in the human body, which y'all know. So when we look at environmental risks, we should consider these heavy metals, but also look at it from the nutrition perception. For example, vitamin B12 and iron, two separate nutrients, but they come from heavy metals. These are just some of the, the micronutrient aspects of them, and this is just generalized, but you'll notice the similarities in some of these healthy foods where you get these. There's a couple more. Let's see. So there's no human use or proven biological function for some of the big four. I call them mercury, lead, arsenic, and cadmium. And our bodies can mistake these micronutrients. For example, in the case of calcium and maternal bone, lead, it will to absorb that lead. So framing this discussion around nutrition, patients who are versed and interested in environmental issues may be less likely to tune this conversation out. And it would demonstrate a willingness to engage in the role of nutrition and disease, just from another angle. One important point I wanted to point out, folic acid. The role of folic acid in birth defects is actually one of the reasons that was the background of why our program actually started. This happened along the border in Texas, where their birth defects were, there was sort of a cluster that was found, and it was really just due to the lack of folic acid. So not simple, but just incorporating a nutrition, that nutritious element or those vitamins could have prevented those birth defects in Brownsville, which was one of the points that, like I say, began our program. So I didn't want to disclude nutrition in this discussion. So are your patients in a food desert? EPA has a tool. It's called EJ Screen. You can go there and take a look and see, are your patients in in a food desert? And are there critical service gaps? These are things you can very easily see if you go to that link. Do they have a lack of health insurance? And is it hard for them to access green space? You can also go into the EPA's EJ Screen, which they're updating all the time. Get a really quick look in your area locally at things like air toxics, PM 2.5, ozone. So let me just drag my screen over for that one quickly and just show you just how easy it is to get to that one. If you want to take a look, here's EJ Screen. You could choose anywhere. I see our region kind of 6 here. And critical service gaps. You just click food desert and it's going to show you where the food deserts are. So you can incorporate that nutrition discussion into maybe something that you're doing. Lack of health insurance is another quick one. It might take a minute to load. That's a lot of data. Not sure why it's not loading for y'all, but it does. It's really good. It comes up and might have a lot of windows open. Sorry about that. I don't see it showing up, but it is a lot of data in there. They've also got, like I say, particulate matter, ozone, different types of things that you can look at and read about the metadata behind them, like how they're coming up with these different measures. So now, if you wanted to kind of create a report summary for this ask, how does your state compare with the US when it comes to lung cancer? That's probably where I would start. And again, going back to American Lung Association, they've got a link really good. Let me show you what they've got. Oh, look, here's that data that pulled up for health crisis, critical service gaps, lack of health insurance. Okay. I think my things are moved around. Okay, let's get it. Not association. Oh, you know what? Not really $5. So if you go to that link, it's going to show you state data. You just go to this link here, American Lung Association state data. It's going to give you different types of measures that you can look at. And here, lung cancer rates, new cases. Gives you a great graphic. Who's in the top 5? Kentucky, West Virginia, Mississippi, Tennessee, Maine, and all down the line. And you could find where your state kind of falls along here. Here's us, we're way up here, 61%. So it gives you state rankings for incidents, I think stage of diagnosis as well, and other types of things. There's a lot of really good resources on cancer, but this one to me was a really quick way of kind of seeing, okay, where do I stand? Where does my state stand? First of all, not even looking at like a smaller county or parish level yet, so it gives you a lay of the land sort of, so you can start talking about if someone's, correlates being in poor air quality with lung cancer. That would maybe be a first step. You could talk about, how, where our state stands, not inferring anything else. But again, what's causing lung cancer? We know smoking, that's something that's pretty well established, and we have smoking cessation efforts in place, and it's a good thing to, I'm going to show you the purpose information, which is a survey, but also radon. This is something that's not discussed as much, but it's actually becoming more and more discussed today. That's actually the second leading cause of lung cancer if you don't smoke, and worse if you do. And of course, there are genetics, underlying health factors, medicines that you take, and these kind of things. Who knows? There's occupational exposure is a big one as well. And of course, outdoor pollution is going to have some role there, some piece of the pie chart. We're not exactly sure. Okay, so the BRFIS data, behavioral risk factor surveillance system. If you really wanted to take a look, of course, we know about the latency of cancer, but how does your state compare when it comes to smoking rates? That would be, again, one of the first things I would look at, because that's the thing that's the most well known, and that would be the usual suspect. So taking a look at the BRFIS, they have a great tool. And I provided that also in there. You can explore it on your own, and you can look by location. You can choose your state. I chose Arkansas here. They've got tobacco use. They also have e-cigarette use now, which I think is important. You can look at current smoker status, but what's amazing to me now is look at how far back this data goes. You could go all the way back to 1995 and be like, okay, let's see. Because if that cancer latency really held true, let's say 30 to 50 years is some of the ballparks that I've read. I'm not really sure. I know for asbestos, it's more like 10. But let's just say you're like, okay, well, does my state have a high lung cancer rate? And then do we really smoke that much more than everybody else? And so you could take a look at this and look at it compared to all other states. And you would go here, I believe it is. and take a look at how you compare. So again, in terms of time, it's a really quick way of looking at, how much worse am I really than everybody else? So you can see our rates are high, and also we have a pretty prevalence of, smokies way back to smokers going way back to 1995. So I thought this was some really incredible data that you can kind of use to support. It's like, hey, we're not just piling on smoking. It really, some of those states that you saw in there, that they were smokers way back in the day. So it's not something that you have to talk over. I mean, that's actually proven. You can see this in data. Okay, so just real quickly, actually might just jump over this because there's some other couple things I wanted to show you before we go back to my data explorer, the one for Louisiana. But we do have now statistical significance data for lung cancer and many other cancers, where you can see statistically significantly higher or similar or lower rates for smoking. So this is a tool that we have, but we got lucky. Our tumor registry, shared this data with us, and they were actually required in a way by the legislature to provide this data. So I'm going to show you this and maybe some green space data short. We have time. Go off trail on the safari. This is another thing that you can see on our Explorer, and this is childhood blood lead data. We have data now working through our partners in the lead program where we could look at the testing rates and then the elevated lead, blood lead rates in children, which is really powerful data to have now at the sub-county level. We've always kind of known at the parish level that we have a really a problem in certain areas with the childhood blood leads, but in this case, for our state, and I'll read the specific law. By law, healthcare providers in Louisiana must make sure every child between 6 months and 6 years has a blood lead test. This is per Administrative Code 4870. So if we're not testing and we have high elevated rates, this is something you're going to be able to see on our data explorer. And other states, advancing states, are doing this as well. So that's really strong impetus for, physicians testing children in those areas, even if they fill out that questionnaire and, maybe don't feel that they have a high risk. This would be another resource you could use to say, oh, let's get the test. It is required at some point during that span of time. Okay. And again, 6 months to 6 years, not done in the beginning at the newborn screening, but it would be done with either a capillary like the tube test or the Phoenix test. Quick discussion on radon. Here's the EPA map of radon zones in most of our region 6. We partner with the PSHU on different things. Doesn't seem to be very high risk. It's the yellow zone, low potential. However, we have new data that's available through the national program, National CDC Tracking Program, which our state actually was able to submit a lot of new data. Our data is over 25 years old, but we've requested new data and we've supplied that to CDC, and they have these really cool visualizations now. This is a GIF. I downloaded this right from their site. This is the national surveillance system, the CDC National Tracking Program, Oklahoma. And they have, if I click this link now, it goes directly to the search that I did for that specific measure for that specific state. So I'm going to show that real quickly. Yeah, here's the map of the radon zones if you're interested in seeing that map up close. But here, let me just click that. I'm going to show you. It's going to take me directly to. Look how it takes you right. It's already knows what I. Oh, did not do it. Okay, maybe I didn't do it. Okay. But if I searched for radon and I chose my state, the test from states, that's us, labs, it's CDC's data. I look at the maximum pre-mitigation radon in tested buildings. So this is before any mitigation was done. What was the highest level that we saw in radon? Just to get a sense. And I look at state by county. Let's just choose that Oklahoma. You can put this in the presentation really easily. Also, I must have clicked the wrong list, but here's the data again. And if I want to play, here you go. This is over 10 years. This data is much stronger than what we have. We don't have it on our website yet, by the way, but many states do, that are in the tracking program. So you can start to see those counties that actually have at least one, sometimes more over 10-year period within this health limit of 4 picocures per liter. So it's not, it's not negligible, the radon risk in these states. And the actual radon map does say, the EPA does say, hey, just because you see low potential doesn't mean it's always, it's not that expensive, and it's even mitigation's not that expensive. So we're trying, a lot of states are really trying to get that funding so that we can get these tests up to people, even just, paid for, because it's being shown to be a much higher risk. FYI, in Maine, that fifth state for the cancer risk, they have a really big problem, but many states do. Okay. And just quickly, if I click this share button and put it in my presentation, it would take me directly to this result. So you wouldn't have to go through all of that search. You can also download these data. Here's that animated GIF. If you wanted to put it in a presentation, it just downloads it and you just pop it in. I really like this tool. There's so many things you can get from our funders, of course, from CDC. Their data is a lot more current than ours usually as well. Okay, so I see I'm getting near the end of time, so let me move a little quicker. Show you just the links maybe. Yeah, here's the bonus. This is a great link if you want to go to this TRI Explorer. Let's say you're like, okay, I really want to look at the industries now. We've looked at everything else. Now I want to see what's going on. You can see some of this toxic release inventory data. Doesn't mean, of course, that you can link any type of exposure, but you can see what's going on in your area and locally. This is really cool data that they have. TRI fact sheet. Didn't load it, of course, for presentation, it doesn't load. But you can search your state or your zip code. So I put this one in that I know is near me. And it's going to tell you what's near you at that link I provided. You can go by zip code. So you put your own zip code in, and what should happen, and I wish it would show up for this one. It gives you a map with these little, here it comes, there it is. I have to reload it. Look. You can go in here and it's going to tell you exactly who's there. It's really quick. You click on it, it's going to tell you which industry that is. And if you want to know more about it, it gives you all these cool graphs and things you can look at all the time. So real quick, you don't have to do a download of EPA's data, that kind of stuff. There's many different things where you can just get a report, and it will give you very quick graphs. And things like that that you can use to kind of inform yourself of what's going on very locally. All right, so one last one I want to show you, and I'll stop there because you can explore Louisiana's Data Explorer at any time and search for that lead data and search for that cancer data. Kind of just wanted to show it off a little bit. I'm very proud of it, but for everyone's on this call for your area, this would be maybe more useful to you. And it's some of these resources for toxicological profiles from ATSDR and ToxFacts. And I love this one. This is one I recently found. It's the report on carcinogens dashboard. Let me show you that one here. Yeah. You choose, let's say you did that TRI report and you found a couple industries or you found a couple chemicals. Like, man, there's a lot of that going on. Is it a carcinogen? You can search for that here. You can go by substance or by chemical or by cancer type. So let's say you wanted to look for chemicals that cause lung cancer. If that's someone's specific concern, you can search that way. If you want to go by substance type, if you see it in that report, you can do it that way. Again, a real click of the button gives you a report on some of these substances. And you can go back to, again, these resources if you want to know about a specific chemical. So I'll stop there and open it up for questions. We also have the post-test questions. I don't know how y'all want to do it, but let me know.
Thank you so much, Ms. Friedman, for teaching us all about all these resources. I had no idea that there were so many free resources available to us. So that was really cool. Anyone, if you guys have any questions, please go ahead and put them in the chat so that we can see them. So far, we don't have any questions submitted, but we'll give folks a few minutes. Okay, it looks like someone's working on a question. Okay, so first question, what prompted the need to capture all this type of tracking? Were you seeing something in individuals in the area?
This actually started, I want to say way back in like 2000 and 2001. There was an important report, a couple of reports that actually came out, Institute of Medicine, um, a couple others, and they pretty much, said there's a major need for us to start standardizing our environmental and health data so that we can look at the links between environment and health and exposures and health. Because, the answer, I guess, maybe always seems to be we just don't know. We don't know enough about the chemical. We don't know enough about the exposure pathway. Does that chemical have a limit set? And if so, is it carcinogen, and does it affect the person? And there just were too many unknowns. So the report came out and said, look, we need to have a standardized surveillance, environmental health surveillance system nationwide. And that's where it kind of began. And CDC was, soon after funded by the Congress appropriations to get money for the national program. And then afterwards, it became a competitive cooperative agreement for states to apply every 3 to 5 years or so to become a part of the program. And we became a part of the program in 2009. And I will say we've reached out to all of our states around us, every time the applications come out, okay, if, not to give you an edge, you can't do that, right? But we are allowed to partner, to help people to apply for the grant, give them information and things like that for the program.
Great, thank you. Another question, well, a couple people are asking if it's okay that we send out a copy of your slides.
Yeah, that's fine.
Great, and we can do that after the presentation. And also, a lot of the links are in the presenter notes that were provided, and I can put the link in the chat again. Another question that came from the audience is, I love the smoking and cancer tools you showed us. Do you know of any data that we could use that is specific to vaping topics? I get requests to speak with youth who are addicted to vaping. And that is from Jessica with the Southeast Texas Poison Center.
Um, that one, I recently saw Dr. Monk's presentation on that at the environmental symposium. I would have to defer you to Stormy. She gave a great presentation on that and the risks of vaping and all these kind of new things that are coming out. So I don't personally have that. Like what I showed you was they do in the BRFIS, they do have that now. Some states have included that in the BRFIS survey, so you can maybe look that up. But I would defer to the PSU for that one and see what they know about vaping. Or for a smoking cessation program. I'd refer you probably to them.
Thank you. And for Jessica, who asked the question, maybe we could invite Dr. Monks to speak to the Texas Poison Center Network, give us some teaching on vaping. That would be great. All right. Does anyone else have any questions for Ms. Friedman?
Yeah, and let me know if you want me to run through the post-test questions or if you just want to send those out. Either one is fine with me.
Oh, do you have slides?
Yeah, I actually have them next.
Yeah, I think that's a great idea.
Okay.
Oh, and one more question. What have been some of the interventions to get the community involved?
Yeah, that's always been a challenge. What is the best way? Like, who's our audience? For this presentation, I wanted to focus on the physicians, because that's who this audience is. Like, if you got that hard question, it's like, what do I say? People are concerned about the air quality. It's very real. and they're concerned about carcinogens and how much of a part does that play in their lung cancer risk or other cancer risk. It's an unknown. But yeah, to get the community involved, from our perspective, we have, we're still trying to figure that out. Like we need to partner with strong, communications experts, I think. And, folks like the PSU, folks like we have many different partners. The Louisiana Center for Health Equity, for example, is one of our partners. We try to find ways to reach out and get in touch with the communities and share information. Up till now, we've done things like create reports, right? And maybe that's not that accessible to the public. So we're looking for new formats. We're looking for things that are more interactive, videos, different types of presentation styles. You saw the CDC tracking program, how they have the GIFs now. You can share the information. We're looking for that. That's something that we struggle with, kind of coming out of the ivory tower and really getting the information to the public. So be very open to getting thoughts on that or insights on that, how we can better engage with communities and share information and resources.
And the person who asked the question says, awesome response. It is challenging.
Okay, well,
Looks like all the questions. If we do have 5 minutes, if you'd like to go through the post-test questions, I think that would be helpful.
okay. True or false? The human body cannot absorb vitamins A, D, E, or K, certain minerals or antioxidants without the help of dietary fats. What do you think? You want to put it in the chat? It's actually true. I love the fact that actually there are fat soluble vitamins. You need fat to absorb so, a little bit, right? So this is just another way you could kind of frame and engage a discussion, I think, with patients maybe. Like, hey, yeah, just need a healthy balance, to be able to use those vitamins from your vegetables and fruits, you actually do need a little bit of healthy fat. But that could open the discussion of, hey, what are the best sources and how do we avoid the bad fats? So according to American Lung Association, which New England state joined the top 5 for lung cancer cases, new incidents, 18 plus, showed that in the ALA. Yeah, it was Maine. That one kind of shocks me because I'm like, okay, now I look at the burgers and see, did they really smoke that much more than anything else? And I can't recall. I think they kind of do actually, but they also have that radon risk. So that's kind of why I looked. I like comparing these two resources to see, the smoking and then maybe the radon, maybe some of the other things. So multiple choice, which of these heavy metals in the list have no known use or benefit in the human body, even in trace quantities? I think everybody maybe knows this one as I really drilled it in. I mean, these systemic poisons, arsenic, lead, these are things, they were like, they used them for assassinations and things, and just a very small amount on the tip of a pencil, they say, for lead. Things like this could cause neurological damage. So there's really nothing good that comes from these metals, but our body mistakes them for nutrients sometimes. This one, I probably should, this is not a fair question because I didn't really talk about dioxins, but it's related to nutrition. Because they are absorbed and stored in fat tissue and accumulate up the food chain, it's very similar to mercury in fish, the highest risk of human dioxin exposure is actually through, and these are all causes of, these are all sources of dioxin exposure. It's very serious, like PCBs, like this type of thing, these persistent chemicals and metals and so on, but it's actually food. So because of that bioaccumulation, that's really your highest source of risk for dioxin-like compounds. Which of the following is not typically a method for testing blood lead in children? And I mentioned that one. Newborn screening. That, too early. That the baby probably wasn't exposed yet, hopefully. But yeah, that universal testing for our state at least is from 6 months to 6 years. So those exposures are considered to probably be environmental. Okay, and that's all I have. Thank you all.
Hey, thank you so much. I love how you said the dose makes the poison at one point too. That was great. But this was an awesome presentation. So much helpful information for all of us. So we really appreciate it. Anyone, if you have any more questions that come up, please just send us an email and we're happy to pass along your questions to Kate. And then we will be sure to send out an email later on with her slides and a link to the handout again too if you missed that. Thank you so much. Have a great day.
Bye, everybody.